Hi everyone, welcome back to part 2 of the topic classification of cysts of orofacial region. In the last video, we just discussed the introduction about the cysts, the definition, the sources and the basic classification of cyst, right? But in this video, we will be taking up the next topic, which is the classification of cysts of orofacial region in detail. Now this classification is very important. It comes as a long question in university examinations and you must know this, even the MCQs can be asked from this part. Now as such, this classification can be a little difficult to learn, but if you learn with proper mnemonics and tricks, it becomes easier for you to learn this, right? So let's begin. Now the classification of cysts of orofacial region, it's divided into two parts, as we already know, the odontogenic cysts and the non-odontogenic cyst, right? Now each of them, odontogenic and non-odontogenic, they are further divided into developmental, inflammatory. Similarly here, non-odontogenic divided into developmental and inflammatory. Now let's start from the odontogenic cyst, the developmental. Now you must remember some mnemonics and then it will become very easy for you to learn this. Now in developmental, again we have divided this into two parts, the intraosseous cysts and the extraosseous cyst, right? Now in intraosseous, in odontogenic, developmental, intraosseous, you need to remember DOGL, just this mnemonic and you are done, okay? DOGL. DOGL, that stands for D for dentigerous cyst, O for OKC, which is odontogenic keratocyst, G for glandular odontogenic cyst, and L for lateral periodontal cyst. So you remember the mnemonic DOGL for the intraosseous variety in the odontogenic developmental cyst. So D stands for dentigerous, O stands for OKC, G stands for glandular odontogenic cyst, and L stands for your lateral periodontal cyst. So DOGL, this is what you need to remember. Now moving ahead to the extraosseous variety. In this you need to remember EBGG. Now what does that stand for? E stands for eruption cyst, B for botryoid cyst, G for gingival cyst of newborn, and other G stands for gingival cyst of adult. So you remember EBGG, which is eruption cyst, botryoid cyst, gingival cyst of newborn and gingival cyst of adult. So EBGG, okay? Now in odontogenic cyst, when we talk about the inflammatory ones, we have to remember RAPI, RAPI, R for residual, A for apical periodontal cyst, P for paradental cyst, and I for inflammatory collateral cyst, okay? RAPI, residual, apical periodontal, P for paradental, and I for inflammatory collateral cyst. So we are done with the odontogenic cysts. I again repeat, odontogenic divided into two parts, the developmental and inflammatory. Developmental again divided into two parts, intraosseous and extraosseous. For intraosseous, I told you to remember DOGL, which stands for dentigerous odontogenic keratocyst, glandular odontogenic cyst and lateral periodontal cyst. And for extraosseous, you have to remember EBGG, that is basically eruption cyst, botryoid cyst, gingival cyst of newborn and gingival cyst of adult. The next is inflammatory. For this you need to remember RAPI, R for residual, A for apical periodontal, P for paradental, and I for inflammatory collateral cyst. Now moving ahead with the non-odontogenic cyst. Again the non-odontogenic divided into developmental and inflammatory. Now first developmental divided again similarly into intraosseous and extraosseous. In intraosseous, what I need to remember is MMNG, okay? MMNG. How can we remember this? Just letting you know that after M comes N, right? So MMNG, M for median mandibular cyst, another M for median palatal cyst, N for nasomaxillary cyst, and G for globulomaxillary cyst. So M, N, G. Median mandibular cyst, median palatal cyst, nasomaxillary cyst, and globulomaxillary cyst. Now, the second one in developmental is extraosseous. You just have to remember it like that only. Dermoid cyst, epidermoid cyst, palatal cyst of newborn, and thyroglossal duct cyst. Okay, dermoid, epidermoid, palatal cyst of newborn, and thyroglossal duct cyst. Now moving ahead with the inflammatory variety of nonodontogenic. In inflammatory, we again divide the inflammatory into traumatic and infectious. When I talk about traumatic, you have to remember this by SAT. Okay, S for salivary cyst, A for antral cyst, T for traumatic bone cyst. So you remember SAT for traumatic. You remember SAT for traumatic. S for salivary, A for antral, and T for traumatic bone cyst. And the last one is the infectious cyst, in which we have the parasitic cyst. Okay, so like this you have to remember the classification. I advise you to please note down this classification twice or thrice in your notebooks with these mnemonics, and then try to write it without seeing it. It will help you to gain confidence and learn this. Okay, just remember the mnemonics and then continue. Now some one word questions. This is as such not asked in the university examinations. They may be asked in the viva questions or as MCQs. Okay, so first is, which is the most common cyst in the oral cavity? If somebody asks you what is the most common cyst in the oral cavity, the answer to this is the radicular cyst. Okay, we are going to take each one of these in detail from the next video itself. Whichever video I'm going to upload next, I'm going to in detail tell you about each one of these cysts. Okay, the second question is most common odontogenic cyst in oral cavity. Now here odontogenic word is added, so the answer would be same, radicular cyst, since radicular cyst is odontogenic also. Okay, now the third question, which is the most common inflammatory cyst in oral cavity? The answer again is radicular cyst, because we know that radicular cyst is inflammatory and it is most common inflammatory cyst found in the oral cavity. Next question, which is the most common developmental cyst in the oral cavity? Which is the most common developmental? Remember, the most common developmental cyst is the dentigerous cyst. Okay, if you go back to the classification we just now studied, you will see the dentigerous cyst falls in the category of developmental, and it is the most common developmental cyst in the oral cavity. The next question, most common odontogenic developmental cyst in oral cavity. The answer remains same. This is dentigerous cyst, because dentigerous is most common developmental cyst and it is also odontogenic. The next question, most common non-odontogenic developmental cyst. Which is the most common non-odontogenic developmental cyst? Now the answer becomes nasopalatine cyst. The answer becomes nasopalatine cyst. So guys, that was all for today's video. We will meet soon in the upcoming videos where I'll be taking up the individual cysts now. So till then, take care and don't forget to like, share, subscribe and comment down below. Thank you so much for watching.